Have you felt an itch that just won't quit? Maybe it's a nagging sensation on your arms, legs, or scalp that keeps you awake at night, scratching until your skin feels raw. You might brush it off, thinking, it's just old age, or my skin's probably dry. But what if that itch is your body's desperate attempt to warn you of something far more serious, like cancer? As a retired nurse who spent 35 years comforting patients through their toughest battles, I've seen too many seniors dismiss these subtle signs, only to face heartbreaking diagnoses too late. This article isn't just information. It's a plea to listen to your body before it's too late. If you're over 60, please read every word. I'm sharing 6 critical itchy spots that could save your life, along with simple ways to check yourself at home. Let's dive in, because your health is worth it. I'm Sarah Mitchell, a retired nurse who's held the hands of countless patients, from those celebrating recovery to those fighting for one more day. In my years in oncology wards, one truth became crystal clear. Cancer doesn't sneak up without warning. Your body always whispers before it screams. That persistent itch you're ignoring? It could be the first whisper. I've seen it too often, a 72-year-old grandfather scratching his calves, thinking it was just old skin, only to learn it was lymphoma. A 67-year-old woman, dismissing back itching as a bad mattress, was later diagnosed with pancreatic cancer. These stories haunt me because they could have had different endings if they'd acted sooner. Here's the reality. Itching isn't always harmless. According to the National Cancer Institute, up to 40% of cancer patients over 60 experience unexplained itching before other symptoms. That's nearly half. Yet, most seniors wait an average of 5 months before seeking help, often because they don't recognize the danger. Today, I'm making 2 promises. I'll reveal the 6 itchy spots that demand your attention, and I'll share easy at-home checks to catch problems early. Ready? Let's start with what makes dangerous itching different. What makes an itch a red flag? Not every itch means trouble, but dangerous itching has 5 telltale signs. First, it feels deep, like it's coming from inside, not just on the surface. Second, it's persistent, nagging you daily for 3 weeks or more. Third, it's worse at night, stealing your sleep. Fourth, it ignores creams. Moisturizers or anti-itch lotions do nothing. Fifth, it's localized, confined to one specific spot, not all over. Even a mild itch with these traits isn't just aging. It's your body begging for attention. Now, let's explore the 6 itchy spots that could be life-saving signals. Before we begin, I would appreciate it if you like this video. You can help me continue to share the valuable lessons of old age. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Calves that itch at night, a lymphoma warning. Imagine drifting off to sleep, only to be jolted awake by an intense, fiery itch in your calves that feels like it's burning from within. You scratch furiously, but the sensation burrows deeper, as if your nerves are staging a revolt. 74-year-old Margaret, a retired schoolteacher from a small town in Ohio, this was her nightly ordeal for nearly 2 months. I'd wake up at 2 a.m., my calves screaming with this deep, relentless itch, she shared during a consultation. I'd scratch until my skin was raw and bleeding, leaving red welts that stung for hours. I blamed everything: new socks, dry winter air, even my old mattress. Convinced it was a minor irritation, Margaret tried every remedy in her medicine cabinet. Moisturizers, antihistamine creams, even oatmeal baths. Nothing worked. Finally, when the itching persisted in the same 2 spots on her lower legs, she visited her primary care physician. A series of tests, including blood work and a lymph node biopsy, delivered a shocking diagnosis: early-stage Hodgkin's lymphoma, a cancer of the lymphatic system. According to a 2023 study published by the American Society of Hematology, approximately 30% of lymphoma patients report localized itching, particularly in the lower leg, as one of the earliest indicators of the disease. This symptom is especially common in Hodgkin's lymphoma, where malignant cells in the lymph nodes trigger an overactive immune response. The body releases inflammatory chemicals called cytokines, which flood the bloodstream and irritate nerve endings in areas like the calves, where nerve density is particularly high. This results in a deep, gnawing itch that feels distinctly different from surface-level irritations caused by eczema, allergies, or dry skin. Unlike typical itching, lymphoma-related itching often intensifies at night, disrupting sleep and resisting relief from over-the-counter treatments. In some cases, patients describe it as a crawling or burning sensation that seems to originate beneath the skin. Margaret's experience is a sobering reminder of how easily serious symptoms can be mistaken for benign issues. "I kept telling myself it was nothing, just a nuisance," she admitted, her voice tinged with regret. "I wish I'd trusted my instincts and gone to the doctor sooner." Oncologists note that persistent, localized calf itching, especially when it lasts more than 2 weeks and is accompanied by other systemic symptoms like fatigue, unexplained weight loss, night sweats, or swollen lymph nodes, should never be ignored. Diagnostic steps typically include a complete blood count, CBC, to check most recent MESSAG for abnormalities, followed by imaging scans like CT or PET, and possibly a lymph node biopsy to confirm lymphoma. For those experiencing similar symptoms, experts recommend keeping a symptom journal to track the itch's location, intensity, and timing. If the itching is confined to specific spots on the calves, feels unusually deep, occurs primarily at night, and persists despite topical treatments, it's time to seek medical attention. Margaret's diagnosis, caught in its early stages, allowed her to begin treatment promptly, significantly improving her prognosis. "I'm so grateful I didn't wait longer," she said. If you're grappling with relentless calf itching that defies explanation, don't hesitate. Consult a healthcare provider to explore potential underlying causes. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. Back itching between shoulder blades. Pancreatic cancer's hidden clue. Picture yourself lying in bed, tormented by an itch in the middle of your back, right between your shoulder blades, where no amount of twisting or scratching can reach it. It's a maddeningly precise spot, like a pinpoint of irritation that drives you to distraction. For 69-year-old Susan, a librarian from a quiet suburb in Colorado, this itch became an obsession. It was like a single coin-sized patch that wouldn't quit, she recalled during a follow-up appointment. "I'd wake up in the middle of the night, clawing at my back with a ruler, a hairbrush, anything I could find. I changed my laundry detergent, bought new cotton shirts, and even replaced my office chair, thinking it was causing the problem. I felt silly mentioning it to anyone." For months, Susan dismissed the itch as a minor annoyance, but when she began noticing subtle changes, fatigue, a slight yellowing of her skin, and occasional digestive discomfort, she finally sought medical advice. A battery of tests, including an abdominal ultrasound and CT scan, revealed a pancreatic tumor, a diagnosis that turned her world upside down. The Pancreatic Cancer Action Network reports that up to 20% of pancreatic cancer patients experience localized itching, often in the upper back, as an early symptom, sometimes appearing months before more obvious signs like abdominal pain, weight loss, or jaundice. This itching is caused by the tumor's interference with the bile ducts, which normally carry bile from the liver to the intestines for digestion. When a tumor blocks these ducts, bile acids build up in the bloodstream, irritating nerve endings and triggering intense itching. The upper back, particularly between the shoulder blades, is a common site for this referred itching due to shared neural pathways between the abdominal organs and the spinal nerves in the upper back. This results in a deep, unrelenting itch that feels distinctly different from surface-level skin irritations like rashes or allergies. The sensation often worsens at night, leaving patients restless and frustrated. Susan's story highlights the insidious nature of pancreatic cancer, which is notoriously difficult to detect early. "I ignored it for so long because it seemed so small," she reflected, her voice heavy with hindsight. "If I'd gone to the doctor sooner, maybe they could have caught it before it spread." Medical experts emphasize that persistent, localized itching in the upper back, especially in a specific spot that resists topical treatments like steroid creams or antihistamines, should prompt further investigation. Additional red flags include jaundice, yellowing of the skin or eyes, dark urine, light-colored stools, or unexplained weight loss. Diagnostic steps may include blood tests to assess liver and pancreatic function, imaging studies like MRIs or endoscopic ultrasounds, and referral to a gastroenterologist or oncologist for further evaluation. Susan's diagnosis, though devastating, was caught at a stage where treatment was still possible. "I'm fighting now, and that's what matters," she said. To catch similar issues early, experts advise paying close attention to persistent, unexplained itching, particularly if it's confined to a small area and accompanied by systemic symptoms. If you're experiencing a deep, unreachable itch between your shoulder blades that disrupts your sleep or daily life, don't brush it off as insignificant. Schedule a medical evaluation to rule out serious conditions like pancreatic cancer. 3. Scalp itching, a leukemia signal. Your scalp is naturally sensitive, so a fleeting itch might seem like a normal part of life. Perhaps a reaction to a new shampoo, seasonal dryness, or a minor irritation. But for 71-year-old Henry, a retired mechanic from a rural Texas town, the itching behind his ears was anything but ordinary. It felt like something was crawling under my skin, deep and constant, he described during a clinic visit. I'd scratch until my scalp was sore, but it wouldn't stop. I went through 5 different shampoos, thinking it was dandruff or an allergy. I never thought it could be something like cancer. After weeks of relentless itching, Henry's wife insisted he see a doctor. A routine blood test revealed an alarming abnormality, an elevated white blood cell count. Further tests, including a bone marrow biopsy, confirmed a diagnosis of leukemia, a cancer of the blood and bone marrow. The Leukemia and Lymphoma Society reports that approximately 15% of leukemia patients experience persistent scalp itching as an early symptom, often before more systemic signs like frequent infections, easy bruising, or extreme fatigue emerge. This itching is caused by the overproduction of abnormal white blood cells, which release inflammatory chemicals that inflame the scalp's highly sensitive nerve endings. Unlike common scalp irritations such as dandruff, psoriasis, or contact dermatitis, leukemia-related itching feels deeper, more intense, and resistant to standard treatments like medicated shampoos, antihistamines, or corticosteroid creams. The itch is often localized to specific areas, such as behind the ears, at the base of the skull, or along the crown, and may persist for weeks or even months without relief. Henry's experience underscores the importance of taking persistent symptoms seriously. I thought it was just part of getting older, he said, shaking his head. If my wife hadn't pushed me to go to the doctor, I might have waited until it was too late. Oncologists stress that while scalp itching alone is not enough to diagnose leukemia, its persistence, intensity, and resistance to treatment are significant red flags. Accompanying symptoms like unexplained fever, night sweats, swollen lymph nodes, or frequent infections should further prompt investigation. Diagnostic steps typically begin with a complete blood count, CBC, to evaluate white blood cell levels, followed by additional tests like flow cytometry, bone marrow aspiration, or imaging studies if abnormalities are detected. Henry's early diagnosis allowed him to start treatment promptly, improving his chances of remission. "I'm still here, and that's what counts," he said with a determined smile. For those experiencing similar symptoms, experts recommend monitoring the itch closely. Does it feel deep and unrelenting? Is it confined to 1 or 2 specific spots? Does it persist despite multiple treatments? If the answer is yes, it's time to consult a healthcare provider. A simple blood test could be the first step toward uncovering a serious condition like leukemia. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 4. Chest or breast itching, inflammatory breast cancer's alarm. For 70-year-old Linda, a retired schoolteacher and avid gardener, the faint itch on her left breast initially seemed like a minor nuisance. She attributed it to a new bra rubbing against her skin or perhaps a reaction to the dry winter air. "It was subtle but persistent, like a tickling sensation deep inside my skin," she recalled during a consultation with her oncologist. At first, she dismissed it, assuming it would resolve on its own. But over the next 4 months, the itching grew more intense, and she noticed troubling changes. Her breast skin thickened, developed a reddish hue, and began to resemble the texture of an orange peel. Alarmed, she sought medical attention, and a series of tests, mammogram, ultrasound, and biopsy, delivered a sobering diagnosis. Inflammatory breast cancer, IBC, a rare and aggressive form of breast cancer that accounts for only 1 to 5% of breast cancer cases, according to the National Cancer Institute. Unlike more common breast cancers, IBC often presents without a palpable lump, making it challenging to detect through routine self-exams or mammograms alone. The American Cancer Society reports that approximately 65% of IBC patients experience persistent itching as one of the earliest symptoms. This itching stems from cancer cells infiltrating and obstructing lymph vessels in the breast, triggering localized inflammation that irritates the surrounding skin nerves. The result is a deep, nagging itch that resists typical remedies like moisturizers, antihistamines, or changes in personal care products. Additional symptoms may include breast swelling, warmth, heaviness, or visible changes like dimpling or inverted nipples. While breast cancer is predominantly associated with women, men are not immune. The National Cancer Institute notes that 1% of breast cancer cases occur in men, with 45% of male patients reporting chest itching as an early warning sign, often accompanied by skin changes or nipple discharge. For both men and women, persistent itching in one breast or chest is, particularly if it lasts for weeks and is paired with visible skin changes, should prompt immediate medical evaluation. Diagnostic tools like MRI, PET scans, or skin biopsies can confirm IBC, and early detection is critical, as this cancer spreads rapidly to lymph nodes and distant organs. If you notice these symptoms, don't hesitate. Schedule a consultation with a healthcare provider, ideally a specialist in breast health, to discuss your concerns and pursue appropriate testing. 5. Anal or genital itching, a sign of hidden cancers. Discussing itching in private areas like the anus or genitals can feel deeply uncomfortable, even taboo, but ignoring such symptoms can have serious consequences. Thomas, a 77-year-old retired electrician and grandfather of 5, learned this lesson firsthand. For over a year, he endured relentless anal itching, which he initially attributed to hemorrhoids, a common issue among seniors. I tried every over-the-counter cream, switched to a high-fiber diet to ease digestion, and even changed my soaps and laundry detergents, but the itching just wouldn't stop, he shared during a support group meeting, embarrassed to discuss it with his doctor. He delayed seeking help until the itching became unbearable, accompanied by occasional blood in his stool. Diagnostic tests, including a colonoscopy and biopsy, revealed anal cancer, a rare malignancy often linked to human papillomavirus, HPV, infection. The Colorectal Cancer Alliance reports that 70% of anal cancer patients experience persistent itching as an early symptom, often before more obvious signs like pain, bleeding, or palpable lumps appear. Similarly, for women, vulvar cancer, a malignancy affecting the external genitalia, presents with itching in 55% of postmenopausal patients, according to data from the Gynecologic Oncology Group. Patricia, a 68-year-old retired nurse, ignored her genital itching for nearly 8 months, dismissing it as a side effect of menopause or irritation from tight clothing. I felt so ashamed to bring it up, even to my gynecologist, she admitted. By the time she sought medical attention, her vulvar cancer had progressed to a stage requiring extensive surgery and radiation, a delay she deeply regretted. Both anal and vulvar cancers are rare but highly treatable when caught early. Persistent itching in these sensitive areas, especially if it worsens at night, feels deep or burning, or is accompanied by skin changes, e.g., redness, sores, or thickening, unusual discharge, or pain, should never be ignored. The stigma surrounding these symptoms can lead to dangerous delays in diagnosis, but early detection significantly improves survival rates. The American Society of Clinical Oncology emphasizes that HPV-related cancers, including anal and vulvar cancers, are on the rise, particularly among older adults with a history of HPV exposure. If you experience these symptoms, overcome any hesitation and consult a healthcare provider, such as a gastroenterologist for anal symptoms or a gynecologist for vulvar symptoms. Be candid about your symptoms, as this information is critical for accurate diagnosis through tests like biopsies, HPV testing, or imaging. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 6. Hands and feet itching. Visceral cancers early warning. For 73-year-old William, a retired mechanic and lifelong smoker, the persistent itching in his palms seemed like a trivial issue, likely caused by dish soap, harsh cleaning chemicals, or dry skin. I kept applying thick hand creams, but the itching spread to the soles of my feet, and it felt deeper, almost like a tingling burn under my skin, he explained to his pulmonologist. Months later, a persistent cough and shortness of breath prompted a chest X-ray, followed by a CT scan, which revealed lung cancer. The connection between his hand and foot itching and the cancer diagnosis wasn't immediately clear, but it's a link that medical research is increasingly recognizing as significant. The American Association for Cancer Research reports that approximately 25% of patients with visceral cancers, those affecting internal organs such as the lungs, stomach, colon, or pancreas, experience itching in their hands and feet as an early symptom. This phenomenon, known as paraneoplastic neuropathy, occurs when cancer cells release toxins or trigger an immune response that irritates peripheral nerves, particularly in the extremities. The resulting itch is often described as deep, burning, or tingling, and it may be accompanied by other neurological symptoms like numbness, weakness, or a pins and needles sensation. In some cases, patients also report systemic symptoms such as unexplained fatigue, weight loss, night sweats, or changes in appetite. Williams' case highlights the importance of recognizing these subtle signs, especially for seniors with risk factors like smoking, occupational exposures, e.g., asbestos or chemicals, or a family history of cancer. The American Lung Association notes that lung cancer, in particular, is often diagnosed at advanced stages due to its vague early symptoms, making awareness of signs like hand and foot itching critical. If you experience persistent, deep itching in your hands or feet, especially if it's bilateral, unrelenting, or paired with other symptoms, consult a healthcare provider promptly. Tests such as blood work, e.g., to check for tumor markers, nerve conduction studies, or imaging, e.g., CT or PET scans, can help identify underlying malignancies before they progress. At-home checks to stay proactive and empowered. You don't need a medical degree to take charge of your health. By listening to your body and acting swiftly, you can catch potential warning signs before they escalate. Below are 5 detailed, actionable self-checks to help you stay vigilant, particularly if you're over 60. The 3-week rule. The World Health Organization emphasizes that any itch persisting in a specific area for more than 3 weeks warrants medical evaluation. This duration is a critical threshold for seniors, whose immune systems may not respond as robustly to early cancer signals. Keep a symptom journal to track the onset, duration, and intensity of the itching to provide your doctor with precise information. The cream test. If over-the-counter moisturizers, hydrocortisone creams, or antihistamines fail to relieve itching after 7 to 10 days, it's unlikely to be a simple dermatological issue like eczema or dry skin. This resistance to treatment is a red flag for systemic conditions, including cancer, and should prompt further investigation. Symptom watch. Cancer often presents with a constellation of symptoms that may seem unrelated. The Oncology Nursing Society highlights silent partners like unexplained fatigue, lasting more than 2 weeks, unintentional weight loss, more than 5% of body weight in 6 months, night sweats, persistent coughing, or changes in bowel or bladder habits. Document these symptoms and discuss them with your doctor, as they can guide diagnostic decisions. Pattern check. Pay attention to the characteristics of the itching. Does it worsen at night, disrupting sleep? Is it localized to one area, e.g., one breast or calf, or diffuse? Does it feel superficial or deep, like it's emanating from within? Persistent, localized, or nocturnal itching is more likely to signal a systemic issue than generalized, fleeting irritation. Use a notebook or app to log these patterns for your doctor. Family history review. The National Genetics Institute notes that individuals with a family history of cancer, particularly breast, colorectal, lung, lymphoma, or pancreatic cancer, face a 2 to 3-fold higher risk of developing cancer themselves. If you have a genetic predisposition, be extra vigilant about symptoms like persistent itching, and discuss your family history with your doctor to assess your risk profile. When you visit a healthcare provider, provide a comprehensive account of your symptoms. When the itching started, its intensity and location, any triggers or patterns, e.g., worse at night or after certain activities, and any accompanying symptoms like fatigue or weight loss. Request specific tests based on the affected area, such as mammograms for breast itching, colonoscopies for anal itching, or CT scans for hand and foot itching. Global health data from the World Health Organization underscores that early detection of cancer can boost treatment success rates to over 85%, while delays can reduce survival chances by 50% or more. Acting promptly can make all the difference. A personal plea from a veteran nurse. In my 35 years as a registered nurse, I've witnessed the transformative power of early detection and the devastating consequences of waiting too long. I've cared for patients like Margaret, a 64-year-old librarian whose persistent calf itching led to an early diagnosis of lymphoma. Thanks to her proactive approach and timely treatment, she's now cancer-free, spending her days dancing with her grandchildren and tending to her beloved rose garden. Similarly, Susan, a 71-year-old church volunteer, noticed a nagging itch on her lower back that wouldn't relent. Her decision to see a doctor uncovered pancreatic cancer at a stage early enough for surgical intervention. Today, she's thriving, baking her famous pecan pies for her church's weekly gatherings and cherishing time with her family. But I've also sat with patients and their families in moments of profound sorrow, when cancers were detected too late for effective treatment. I've held hands and listened to regrets, wishes that they'd acted sooner, that they'd taken that minor symptom seriously. Your body is always communicating, and persistent itching, especially in areas like the calves, back, scalp, chest, genitals, or hands and feet, can be its way of sounding an alarm. For those over 60, these signals are particularly critical, as age increases the risk of malignancies and complicates treatment. Don't let fear, embarrassment, or the temptation to dismiss symptoms as just aging keep you from acting. A single doctor's visit, a few targeted tests, or an open conversation about your symptoms could be the difference between a manageable condition and a battle you didn't see coming. You are more than a statistic. You're a parent, a grandparent, a friend, a cornerstone of your community. Your loved ones need your presence, your wisdom, and your joy. That minor itch could be your body's way of fighting for you. Listen to it, take it seriously, and take action today. If this message resonates with you, share it with someone you care about. It could be the nudge that saves their life. Here's to your health, your resilience, and a future filled with moments of connection, laughter, and vitality. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-saving tips. Here's to your health and a vibrant future. Act today, because you're worth it.